healthcare systems in Africa are mostly in unworkable conditions with very poor health outcomes. Several studies have looked at the challenges of the healthcare system in Africa, and all summarize the leading challenges as an inadequate human resource for health, inadequate budgetary allocations to healthcare, poor leadership and management in healthcare. In this podcast, I will be evaluating these three problems, which account for over 2/3 of the perceived issues in the healthcare sector in Africa. When viewed from the perspective of the 6 WHO pillars of the healthcare system, the leading problems still clustered around leadership and governance, healthcare workforce, and health service delivery and financing. Although this categorization may seem to overshadow the individual issues that make up these categories, it enables prioritization of the segments of the healthcare system most affected or requiring urgent attention. These findings are similar to that of Roncarolo and colleagues, which found that the most frequently reported challenges in the health sector related to human resources, 22%, leadership and governance, 21%, health service delivery, 24%. The findings suggest that addressing these three key challenges in the healthcare system may solve over 2/3 of the problems associated with the healthcare system in Africa. At the individual level, several studies showed that inadequate human resource is the foremost leading challenge in the health sector in Africa. This is both overt and covert, which reflects the complexity of this challenge. It is overt in inadequate number, mix, and distribution resulting from the insufficient output from training institutions, brain drain to Europe, America, and Asia, and unfavorable governmental policies mitigating employment into the civil services. Covert reasons include poor availability of engaged healthcare workers to deliver services, resulting from healthcare worker strikes, attendance at private practice, rather than public hospitals, internal migration to big cities, and poor attitude to work. This is in line with the findings, which showed that sub-Saharan Africa faces the most significant challenges in the shortage of human resources for health. Every component of the healthcare system depends on the people who manage and provide the services. For instance, healthcare provision relies very much on the people who provide the services to clients. Yet, attention and support to the healthcare workforce have not received the priority it deserves over the years. Little wonders, African countries are experiencing a disproportionate global disease burden of 24%, with the least share of the health workforce at only 3%. The same study showed that out of 57 countries globally classified as having critical healthcare workforce numbers, 36 are in sub-Saharan Africa. However, some countries in Europe are beginning to have similar challenges. These have implications at all levels, starting with households, especially those who are poor and those who live in rural areas with limited access to quality health care. This may be due to a lack of qualified health personnel and health facilities, leading to poor health outcomes and ultimately impeding national and global health goals. Also, healthcare systems may not respond to public health emergencies such as outbreaks of diseases leading to increased mortality and morbidity in these countries. The major solution proffered to this crucial challenge centered on the capacity building of healthcare workers, which may address this challenge to some extent. Other issues which influence the retention of healthcare workers also need to be investigated. Secondly, inadequate financing of healthcare in Africa is another major challenge identified. This is in tandem with several other previous studies. For instance, several studies found that in most African countries, scarcity of funds for healthcare is a chronic problem, with even the wealthiest countries finding it increasingly difficult to keep up with rising healthcare costs, especially in the face of the ongoing economic downturn. Another study found that in about half of African countries, 40% or more of total healthcare expenditure comprises out-of-pocket payments, OOPs, which are the most regressive way of funding healthcare. The average total healthcare expenditure, THE, in African countries stood at $135 per capita in 2010, but only a tiny fraction of the $3,150 spent on healthcare in an average high-income country. These poor healthcare financing indices are prevalent in Africa despite several declarations signed by African heads of state, including the Abuja Declaration of 2001 on increasing government funding for health, and the 2012 Tunis Declaration on Value for Money, Sustainability, and Accountability in the Health Sector. Although we identified low budgetary allocation to the healthcare sector and poverty as the key financial challenges the healthcare systems face, these are in contrast to some other studies which reported increasing healthcare costs, financial unsustainability, and lack of financial autonomy. The difference in findings may have resulted from the differing perspectives of the study participants. The implication of these findings lies in the fact that inadequate financing of healthcare by many governments leaves the burden for healthcare financing on households, usually through out-of-pockets, which are catastrophic to households, pushing some households into poverty. However, the leading solutions to inadequate funding from health are increasing budgetary allocation to healthcare and healthcare insurance for all. This solution may depend on prevailing economic situations in these countries and other underlying factors that again account for the complexity of this challenge. The third leading challenge identified in this study is poor leadership and management. A survey of leadership challenges in healthcare revealed that one of the underlying reasons for poor leadership stems from managers' unfamiliarity with leadership techniques due to managers' disbelief in the effectiveness and necessity of learning these techniques. Some other authors also documented similar challenges in 2 previous studies in Nigeria. Some of the leadership and management challenges mentioned by respondents include lack of political will, corruption in healthcare systems, poor resource management/inefficiencies, and poor integration of healthcare programs. These factors are similar to those noted in a previous study which outlined issues of subordinate governmental role in health policy and poor oversight of the whole health system. These implications are that poor leadership could lead to increased healthcare costs, reduced efficiency and effectiveness, dissatisfaction among staff due to poor salaries and working conditions, and ultimately resulting in lower patient satisfaction and poor health outcomes. On the other hand, appropriate supervision can create an organizational culture committed to quality, reducing conflicts, improving efficiency and productivity of teams, enhancing staff satisfaction, advancing healthcare system performance, and finally, meeting personal and organizational goals. Improved leadership and management have been preferred to address this challenge. Therefore, the time has come for the African governments, especially Nigeria, to privatize all public hospitals and reinvest its capitation to subsidize projected tariff by private investors to guarantee affordable but safe and quality healthcare services across public hospitals. This will also scale up the staff welfare, competitive salaries to doctors and other healthcare workers, thereby mitigating human resources migration. Also, there is an urgent need for capacity building on this subject, which should be made mandatory beginning from healthcare training institutions and a regular refresher course for all healthcare workers, and finally should be a requirement for leadership in the healthcare sector. In summary, the solutions proffered by the respondents mostly address the issues outlined, as the significant challenges include training and capacity building for health workers, increased budgetary allocation to health, advocacy for political support and commitment, health insurance for all, and improved leadership and management. These must be prioritized for action by policymakers and implementers to see better, healthier, and more functional healthcare systems in Africa, translating into better healthcare outcomes and health indices. I remain your healthcare business strategist, Sunday Clement. I would appreciate your feedback and questions in the comments section below. And please do not forget to click the subscribe button for subsequent episodes of my podcast. Thank you and God bless you.